everyone. Welcome once again to our Asian Health Institute Town Hall. 多謝各位參加我哋今日嘅講座。So today we have a very special guest with us talking about something near and dear to our hearts because all of us are going to go get old one day. And so, and knock on wood, hopefully none of us will have to go to the hospital, but if we do, then this special guest is going to talk about some of her work that's going to make our life a little easier in the hospital setting. And the title today is called Age-Friendly Healthcare Systems, Reimagining Better Care for Older Adults. So it's a system change. It's just one of those many changes that she's made in the healthcare system to help us to have better lives. And so I am Diana Lau. I am the town hall host today, and I am the director of the Asian Health Institute. So I'm going to say this in Chinese. So 好多謝各位今日嚟參加我哋呢個講座。我哋今日嘅講座嘅題目咧就叫做設計關愛老人嘅醫療系統，係等老人係可以喺醫院嗰度得到更好嘅護理嘅。咁我咧就係劉雪艷，係今日嘅講座主持，係加州大學舊金山分校亞裔健康研究院嘅主任。我哋今日其實咧有一個非常之重要嘅講者嚟同我哋講呢個講座嘅。咁我哋而家咧就介紹下佢先。呢個講者咧就係So the speaker today is Miss Jennie Hansen. She told me not to call her Dr. Hansen because she's not used to it, but she's being very humble. She does have an honorary Doctor of Nursing Science degree given to her by the University of Boston. These are some of the 5 things that are very important to her. She's the past CEO of the American Geriatric Society. And that is a society that has the physicians and the healthcare providers who aim at helping the elderly, and is one of the largest membership organizations in the United States for physicians and healthcare providers for geriatrics. She's also, watch this, she's the past president of the AARP. Now, many of you know about the AARP, and some of you might be members of the AARP. And here is the past president sitting here giving our talk today. So we are very privileged and honored to have Jennie coming today to tell us some of the work that she has done in the past. She's also past executive director of ONOP, and she proudly told me that this is her real job for her career, that she has worked on it for almost 25 years. She's so proud of that job. And why? Because she did some groundbreaking work there. She created the PACE program. And I'm going to be showing you a video of her later. And you'll see her testing in Congress about this program. And since she retired from all those jobs, she became a commissioner for the California Governor's Healthcare for All Commission. And that is a big job. She has earned 2 very important awards from UCSF. One is the Audacious Alumni Award in 2019, and the other one is the UCSF Medal Award. And that is the highest honor for all the awards that UCSF gives out every year. We have Jennie here with us to tell us about her work and what new things she's trying to do again. And so this webinar is going to be very enlightening to us. 陳禎娜退休嘅榮譽博士咧，佢咧就係得到好，佢係喺美國嗰度咧係非常之德高望重嘅。佢係曾經做過美國老年病學會嘅前任首席嘅執行官，佢亦都做過呢個 AARP 樂齡會嘅前任主席。佢咧喺三藩市嘅安樂居嗰度咧，佢嗰度喺嗰個機構嗰度做執行官咧，係做咗成25年噶啦。所以佢做呢啲咁嘅工作咧，佢做每一樣嘢咧都係做最 top 嗰個位。咁我喺我哋華人之中咧就非常之感恩咯，即係佢可以叫做係為我哋華人爭光啊。咁佢做完咗呢啲咁重要嘅工作之後咧，佢咧又俾加州嘅州長咧就請咗佢做呢個佢嘅全民醫療委員會嘅專員。咁咧佢係喺加州大學三藩市分校嗰度咧係攞咗個碩士學位嘅。咁所以咧佢咧又得到我哋2019年嘅無畏校友獎喎。咁啊每年得一個校友係得到獎嘅啫。咁啊呢個咧2019年嘅獎就俾佢攞咗啦。咁今年咧就2022年啦。 咁 UCSF 咧每年咧就俾一個 UCSF 嘅獎狀嘅金牌得主就係佢啦，今年。咁所以咧，阿 Jennie 咧就係得到無數嘅獎狀，得到無數嘅即係加州甚至係全國嘅認同啦，佢嘅工作係做得非常之好嘅。咁而家咧，其實咧佢仲有好多嘢嘅，但係instead我講俾你哋聽咧，我而家咧就要放一個短片俾你哋睇，就係幾分鐘嘅啫。咁你睇完之後咧，你就知道陳禎娜博士咧係點樣會做到咁好咁叻咧？就係佢個背景係點樣樣咧，你就對呢個人有多啲認識啦。咁呢個短片咧就其實係 UCSF 同佢做嘅，係2022年佢得到獎嘅時候咧，特別同佢製作呢個短片嘅。So this is a film that UCSF did for Jennie for receiving her 2022 UCSF medal.
I've said in the past that I'm a conservative radical. On the one hand, I have a respect for institutions that have been established, and I oftentimes will work within it. But the radical side is always seeking something that makes sense. Sometimes institutions have rules and procedures that don't make sense. I will fight battles to make sure that happens, tackling even federal government if needed. I'm Jennie Hansen. I was first born here in the United States 3 months after my mother arrived from China. I grew up in Boston in Chinatown, and so it was a very ethnocentric community. And right away, you know that there's an otherism of immigrants. And otherism really does bother me, that people aren't included and recognized for what they have to contribute. So I feel really strongly that people's presence and dignity should be honored regardless of nativity, regardless of language, and regardless of economic status. As a teenager, I enjoyed being a volunteer in the hospital. So nursing became that choice, and I went to Boston College. And it was quite amazing to realize on the entire campus, I ended up being the only Asian female. But after I finished my bachelor's degree in nursing at Boston College, I had an opportunity to either stay on the East Coast or come out here in the West. And UCSF was interesting because of just the setting and just kind of the openness of the school. One of the things that UCSF offers is the ability to really think and create something that may not be existing. When I first chose to be a nurse, I had no idea that my career would be going to Washington to testify before the House Ways and Means.
I think the whole aspect of affordability is there, and some creative ways to look at subsidies to make it possible.
I came from the ground up, from working clinically at the bedside and in a program that served older individuals called Unlock. How I began at Unlock was the ability to think about how people who normally would go to a nursing home but couldn't actually access nursing homes, how would they get care? Could we design a center during the day where older people come for some of their clinical care and they socialize, but then they go home at night and sleep in their own beds? And so we ended up finding that in order to make common sense, meaning this way of aging in your community, we actually had to tackle federal programs like Medicare and Medicaid. So that was the genesis of Unlock. And this became federal legislation in 1997. And over the course of this time, my own parents became beneficiaries of this, which is one of my personal big achievements in my life. And now, here in 2022, there are 31 states that have this program replicated.
And Mr. President, we're absolutely delighted that you could join us for this town hall meeting.
One of the fortunate things I had to experience was being a president of AARP during the time that President Obama took office and worked on the Affordable Care Act. And the AARP was a real key player to help the country see that covering more people with health care that was accessible and affordable was good for the country, not just thinking about older people only. And I was thrilled to be still in office when President Obama signed it into law, and then had the fortune of going on to be the CEO of the American Geriatric Society. Most recently, I've had, in the past 4.5 years, an opportunity to work with the emergency department at UCSF Health to help the emergency departments become more geriatrically competent. That will be significant because geriatric EDs only exist in just under 300 hospitals of the over 5,000 hospitals in the country. So there is some groundbreaking work that's happening here at UCSF. None of this would be possible without the family that I have, like having a husband who's been so supportive, and he and I have been married now 30 years. And the son, Eric, went to graduate school here at UCSF and now is in the orthopedics department and is the section chief. And the incredible and very funny grandchildren that we have. The fact that they know we're a part of their lives is really important to us. Needless to say, being awarded this medal has totally surprised me. And there's a feeling actually of obligation that I need to use this platform for good and for added change. So I take this as a challenge that there is more work to do and making sure that we have the world left a little better.
And here you are, Jennie. You are doing more work with us, sharing your expertise with our community. So, and what I don't know how you all feel out there after watching this video. This is the third time I'm watching this. And I am so inspired by Jennie and her work and her bravery. And notice that in the video, she didn't forget her family. She mentioned about her work. She mentioned about her high achievements. But there, she thanked her family, and we get to see her family and her high achieving son. And usually when women work so hard, families sometimes get left behind, but not in Jennie's case. And Dr. Eric Hansen is a wonderful physician in our orthopedic department. And hopefully one day I'll get to meet him in person. 多謝陳禎娜女士，佢正話嗰個 video 咧就我唔再用中文翻譯啦，因為有個中文字幕喺度，咁我哋好多時睇嘢都係用中文字幕睇㗎啦。咁咧就你哋見到阿陳禎娜女士嘅掙扎嘅過程，同埋得到佢而家嘅地位咧，實在係唔簡單咯。So this is our outline today. 呢個係我哋今日嘅大綱。So basically, Jennie is going to talk about each and every one of this. And what she is introducing to us is yet again another piece of innovative work, which is creating a system that's age-friendly in our complex healthcare organizations. And so without further ado, I'm going to turn it over to her so that she can talk about it. 咁而家呢個大家睇到嘅就係大綱啦 ，OK， 佢會同我哋講逐點咁樣講嘅。咁咧主要嚟講咧，呢啲咧通通都係又係一個創新嘅系統啊。咁我哋而家咧就聽下佢點樣講。
Diana, 多謝晒你。I really appreciate this, and I thank you for inviting me to talk about some things about just better care for older adults.
咁咧Jennie 就客氣，佢話多謝我請佢嚟講關於老人嘅醫療嘅事。
the last thing on the video said that I feel obligated that in getting an award, it's not just the stop, but because I receive an award, I am obligated to make sure that I do more work so that people can benefit from that. And so that is hopefully what I hope to do today by talking about things that would help an older person and have family members feel that they know what to expect, what to do.
咁啊 Jennie 咧就係話，佢尤其是得咗呢啲咁高嘅榮譽嘅獎之後咧，佢就更加要希望自己能夠為社區做多啲貢獻。
I know that all of us, as Diana said, might possibly go to the hospital. We hope we don't, but I think it's, when you have multiple conditions like heart problems or diabetes, or we may fall and hurt our knee, sometimes we do end up in the hospital. So my goal today is to see that some of the things that we who work in hospitals know are really perhaps explained and understood by you, and things that you can do so that you'll have a better experience and feel safer in the hospitals.
咁啊 Jennie 話咧，我哋即係當然係唔想有機會入醫院啦，但係實際嚟講就係好多人都可能喺一生之中係需要入喺醫院嘅。咁佢今日咧就係會同我講講醫院嘅問題啦，就等我哋如果係需要入醫院嘅時候咧，係會覺得係第一覺得自己安全啲啦，係唔係入到去好似都唔知係一個咩嘅環境咁。咁我哋即係佢今日咧就會同大家講一講喺醫院裏邊嘅情形，等大家有個心理嘅預備。咁你就算係入醫院咧，都會係覺得比較係容易接受咯。
And so I'm not going to talk too much about this slide, but the primary point with all this information is that hospitals are very complex. And if you're coming to the hospital for the first time, it can be very scary. Number two, there are so many of us who are getting older now. So about half of the people who go to the hospital are older people. And then the last point here is because their hospitals have different kinds of germs sometimes, and sometimes there are communications that are not real smooth. We can sometimes have a hospital experience that's not wonderful. So our goal is how can we make it hopefully better? So that's why we're talking about this.
咁咧就Jennie 咧就係話醫院咧就其實係都幾得人驚下嘅，因為好多人第一未去過啦，咁第二咧就係醫院始終都係一個收重症病人嘅地方，咁大家都個心裏邊覺得好驚咯，入去嘅時候。咁啊第二咧就係因為人口老化呢個問題咧，咁我哋知道咧，因為喺第二戰之後咧就好多細路仔出咗生嘅，咁而家呢啲二戰出生嘅嬰兒咧，就而家咧到咗我哋呢個年紀咧，就係6、7、8、10歲噶啦，咁所以咧就有好多人就老化，咁啊入醫院嘅機會係大咗嘅。咁第三咧，我哋亦都係知道啦，醫院嘅環境咧就係，有好多人都話，打直入去打橫出嚟嘅，咁聽見都驚係嘛？咁實在醫院裏邊咧，其實都有啲細菌啊，有啲其他嘅嘢咧係做得唔係完全好嘅，咁咧就係。而家今日講咧，就係我哋想知道多啲醫院嘅情況咧，等我哋如果需要入去嘅時候咧，係點可以減低一啲傷害，等我哋入到去係雖然有病，但係可以健健康康咁出翻嚟嘅。
There is now nationally a movement to see that we have age-friendly systems so that hospitals pay more attention to older people who will have oftentimes many medicines, many other conditions, not just one problem like a heart problem, and how to make sure that the hospital is safer for older people. And probably most important, not that the hospital only does things to you to take care of you, supposedly, for the best care possible, So often we don't really know what's bothering the person or worrying the family. So the last comment here says, finding out what matters to the older person and their family. It's like asking us, not just telling us to take the pills, that we're going to have this blood test, that we have to go here to this department, but important to get our voice on the table.
咁咧 Jennie 咧就係話，我哋而家咧喺全國嗰度啊，係有一個好大嘅運動發起咗。呢個運動咧就係要做一個將啲醫療系統啊，做一個關愛老人嘅醫療系統，係對嗰啲老人家入醫院咧係友善啲嘅、關愛啲嘅，等佢哋係可以覺得安全啲、安心啲，同埋咧最重要一樣嘢咧就佢哋去醫院咧就唔係淨係話去做手術啊，或者係去食藥啊，將個身體嘅狀況搞翻好，係仲要同醫院裏邊嘅人溝通。係醫院嘅員工咧，係知道佢個心嗰度想咩嘢咧？佢個心覺得咩嘢最重要咧？最掛住咧？而我哋係咪可以幫到佢咧？咁所以咧，呢個咧係呢個成個系統嘅一個好重要嘅環節嚟嘅，即係唔係話淨係做手術、俾藥食，做一啲一定要做嘅嘢，但係喺個人方面咧。個病人係一個人嚟嘅，係一個老人家嚟嘅，佢係有佢嘅希望，有佢嘅心意嘅。佢嘅心意到底係咩咧？所以呢個就係關愛老人嘅醫療系統嘅一個其中一個特點。
The reason there are these 4 areas is that there is a foundation in New York that has been led actually also by a nurse who wants to try to make the hospital easier for the doctors and nurses to give care and to give the best type of care for older people. And so they did studies over many years, and they probably have about 100 recommendations, but 100 recommendations is way too much. And so we have reduced it to 4 big areas that we expect the hospitals that get this stamp of approval called the age-friendly health system, will pay attention always to these 4 things.
Jennie 話咧喺紐約嗰度咧，就有一個 foundation 裏邊有個 nurse 咧，佢咧就好想係將呢個醫療系統咧，係將佢變得容易啲去俾呢個治療，俾個病人嘅治療，同埋咧係可以俾佢哋最好嘅治療。咁咧佢咧就做咗成100個不同嘅少少嘅研究啦。咁咧即係佢做咗研究，咁然後 come up with 100個不同嘅建議，咁咧100個嘅建議咁咪散收咯。咁於是咧佢哋咧就呢班人咧就將佢哋分成4組啊，將呢100個嘅建議咧睇個性質咧就將佢分咗4組。咁而家就睇你就見到嗰4個圈啦，橙黃綠藍嗰4個圈啦，就係嗰4組啦。
And the first one I started to talk about in the earlier slide, but typically hospitals never normally cover this question. And the question is, what we brought up earlier is really coming into the hospital, what matters to you that you have a good hospital experience? What are you worried about? And what's most important to you? Do you want, some people have names on their legal names, but maybe they use a short name and would rather be called that. Something as simple as how you might be addressed could be very important to your sense of your dignity. So this is first and not standard what you think of medical care, but it's so important to be respectful to the individual to understand what's important to them.
呢個圖片咧有4樣嘢啦，咁黃色嗰個咧就係話係乜嘢嘢對個病人最重要咧？即係我哋病人入嚟醫院咧，好多時我哋呢條問題咧係冇問佢哋嘅。佢入嚟跌斷咗邊度啊？我哋同佢去手術啦，做好佢啦。佢需要糖尿病食咩藥啊？心臟病食咩藥啊？我哋俾嗰啲藥佢食啦。咁喺嗰啲方面咧，我哋係做得好好嘅。但係對個病人嘅心理啊，到底呢個病人覺得咩最重要咧？ 我哋好多時冇問佢嘅喎，冇話你今次入醫院，婆婆公公，你覺得有咩嘢對你係最重要㗎咁？我哋冇問呢條問題，但係呢條係非常重要嘅問題嚟咯。咁所以咧，因為譬如你可以問下佢，你話我哋可以做啲咩嘢，等你今次入嚟醫院係可以覺得順利啲啊，覺得安心啲啊，或者你有咩憂慮啊？你需唔需要知道我哋譬如我哋嗰啲員工嗰啲名啊，你需要成個名啊，有埋姓啊，抑或係淨係嗰個個名就得啦咁。咁即係有時有啲咁嘅溝通咧，咁咧就等個病人咧覺得你尊重佢。咁啊尊重呢樣嘢咧，呢兩個字咧就真係非常非常之貴嘅，因為錢都買唔到。但係我哋如果可以同病人有咁嘅溝通，佢哋覺得我哋尊重佢嘅，咁成個住院嘅過程咧就會好好多噶啦。
Another one in the green section here is about medications. Many of us as older people sometimes take 4, 5, up to 20 medicines. And so it's so important to make sure that we have the right kind of medicine, because sometimes people think, oh, if I have lots of medicine, it's good for me. But sometimes these medicines aren't always the best. And sometimes medicine to medicine reacts negatively. So it's real important when we come to a hospital and we take many medicines that the doctors and nurses evaluate to see if this is the best. And many times when people in the hospital, maybe they come in and 20 pills, or excuse me, 20 medicines, they get reduced down to like 7. And that may mean you're safer and better with the right medicine.
綠色嗰個圈咧就係講藥物，啲病人食嘅藥物。咁啊第一件事，如果你想我哋要知道你嘅藥物，除非即係你嗰個醫療檔案喺個醫院裏邊啦，咁就知道晒你食咩藥物啦。如果唔係嘅話咧，你就最好將嗰啲藥物咧，一係就將佢抌晒入個袋嗰度，咁啊帶晒入嚟俾個醫院嗰度，等嗰啲醫生去 check 佢啦。咁啊，如果冇嘅咧，你唔想帶咧，你就可以將佢抄低咗佢個名。或者影相啊，我同阿 Jennie 講過噶啦，就用個 cell phone 去影咗啲相佢，嗰張紙咧，嗰張貼紙啊。咁咧，你如果將個標籤影咗相咧，就譬如1、2、3、4、5、6、7，你食7個藥㗎，咁你咪將嗰啲相俾個醫生睇咯。咁佢睇咗之後咧，咁佢就可以喺從中嗰度咧，同你去研究下呢啲藥，第一有冇重疊，個功用有冇重疊，食2隻藥都係去水嘅，咁啊冇必要啦，係咪？咁咧第二咧就係咪太多咧？係咪有啲嘢係唔需要食嘅咧？咁第三咧就係仲有呢啲藥同藥之間咧，呢個非常之重要嘅。佢哋會唔會有大家打交嘅？即係個作用啊，大家係相對嘅咁。咁咧好多時咧，點解會有呢個情形發生咧？就係你去睇一個專科，嗰個專科係俾 A、B、C 藥你。去睇第二個專科就俾 C、D、E 藥你，咁啊 C 嗰度咪重疊咗咯。但係佢哋冇時間去睇下人哋嗰啲醫生俾咗咩藥啊嘛。咁所以咧好多時啲藥物咧係有重疊嘅。咁個病人咧又有時蒙查查啦。你其實應該食藥，應該自己知道食咩藥嘅。如果2種藥都同埋一樣嘅咧，你就應該係話俾醫生聽啦。但係有啲病人真係唔識噶嘛。咁所以咧既然入醫院咧，就而家做一個大清檔，就將所有嘅藥物帶晒入嚟，等醫生同你重新睇一次。OK， 甚至叫個藥劑師嚟同你評估一下你嗰啲藥到底有冇多餘嘅。好多時啲病人到咗65歲以後咧，都食4、5隻藥，一日食4、5隻藥咧，係非常之普遍嘅。有啲人食多到9隻、10隻藥嘅。咁但係喺醫院入院嘅過程之中咧，係可能可以將你幫呢啲藥量或者係不同嘅藥減翻低啲。
The blue item is mentation. It's how we're thinking. So it's important to test possible confusion, because sometimes the confusion is because of the medicine, sometimes it's because our health condition, and sometimes it's because we're in the hospital and it becomes very confusing. So it's so important to apply some standard tests to see whether or not this confusion, if it exists, is going to affect our recovery.
咁藍色嗰個圈咧，就係講我哋嘅心理同埋嘅腦智嗰方面嘅情況啦。咁到底我哋入到醫院， 個人嘅精神啊、個心理啊有冇受到影響咧？我哋有冇啲我哋唔好講痴呆咧，而家唔用痴呆呢個叫做腦失智症啦，係咪？或者係有冇憂鬱症啦，或者有冇啲膽妄症啦？咁咧，所以咧嚟到個醫院嗰度咧，係應該有一個心理嘅狀態評估咯。咁咧就可以知道我哋有冇其他嘅需要係其他人士幫忙我哋嘅，其他嘅專業人士幫忙我哋。
And then the last one is mobility. That means moving around. And so often in the days in the past times when people go to the hospital, they want you to stay in bed and they feel you are safer. But the research has actually shown it's important for us to get out of bed, probably at least twice a day, both for our using our muscles and using our balance. So don't worry, especially I'm talking to family members, don't insist that your loved ones stay in bed. Sometimes being in bed for a long time makes you more at risk for falling. And so it's important to maintain our balance and our stability. And this is one of the M's, the mobility.
咁呢個橙色呢個圈咧，就係我哋嘅行動嘅能力啊。咁我哋行動嘅能力咧，就係非常之重要嘅，因為老人家如果行動唔方便咧，就會可能有好多意外發生嘅。咁所以咧，我哋行動方面咧就要尤其是做過手術嘅人咧，以前咧我哋做手術，唔好話做手術啦，生仔都話要瞓床幾多日㗎啦嚇。但係個世界變咗好多啦，已經係變咗好耐，同埋變咗好多。而家咧我哋咧真係開完手術之後幾個鐘頭咧，個病人醒翻咧就叫佢起身落床行路。咁有啲家人咧就見到我哋咁樣做咧，就可能覺得我哋哇乜咁殘忍㗎，好痛喎！啱啱嗰啲止痛劑先過咗，你而家要佢落床行路咁。其實咧，我哋係咁樣做咧，係因為有好多研究發覺咧，如果你留個病人喺個床嗰度瞓得太耐咧，佢係好容易有肺炎啊或者其他嘅症狀發生嘅，即係唔理想嘅症狀啦。咁但係如果你係可以早啲叫佢落地行嘅咧，佢早啲喐下嘅咧，呢啲咁嘅症狀咧就係可以減少咗，甚至唔會出現嘅。所以叫病人開始落地行路，係每日行1-2次，最少即係最好行到2次啦。當然，如果個病人係行路嗰個腳步唔穩嘅咧，就要有人扶啦，同埋即係唔好自己落地行啦。咁通常醫院咧都係有人陪你行噶啦。咁甚至如果你行動真係唔方便咧，係可以叫嗰啲物理治療師嚟幫你行，教你行嘅。如果你屋企嗰度譬如有樓梯嘅咧，咁你更加咧喺醫院嗰度咧，你未翻屋企之前咧，你真係要試下行樓梯先。咁你試下行樓梯咧，咁你咧就會知道，我翻屋企我係可以行到樓梯上屋企嘅喎。如果唔係，你連樓梯都行唔到，或者唔知道行唔行得到嘅時候，你翻到屋企你都唔知可唔可以翻到入屋企門口喎。因為譬如三藩市嗰度咧，好多屋咧都喺2樓噶嘛，住嗰層樓下係個車房嚟噶嘛。咁所以咧，呢個mobility咧係非常之重要。咁我哋本來咧，其實呢啲嘢咧，呢4樣嘢咧，係個醫院裏邊咧，係不同嘅人咧都會做不同嘅嘢，咁樣咧就好多時都會有做嘅咁。但係呢個系統嘅問題啦。一個系統唔係話靠依個護士記得，嗰個護士記得，抑或唔記得，唔係咁嘅。一個系統咧就係話，我唔理你記唔記得，我有個系統喺度咧，個系統係會提你，係要叫你咁做嘅。即係話個個病人都係要咁做，係每個員工都係要咁樣做呢啲嘢。咁呢個先至叫做系統。所以 Jennie 咧將呢個咁嘅系統擺出嚟咧，就係唔係話我哋以前冇做呢啲嘢，呢個當然完全唔係啦。但係我哋係有做。但係唔係用系統性咁樣做，而家咧就要用系統性咁樣做，即係唔會話有漏網之魚，唔會話唔記得同個病人起身行2次嘅，行得1次或者係完全唔行嘅咁，即係唔會有呢啲咁嘅情形發生。呢個就係呢個系統嘅觀念。
So we are hoping that people will know that oftentimes when hospitals talk about your medicine or want you to get up,or they're testing you for your memory, it's all to try to make this experience as safe as possible for you so that you are stronger when you go home.
咁所以大家咧，亦都希望你哋明白，如果醫院嗰度同你哋做呢啲嘢嘅時候咧，佢哋咁樣做咧，就係為咗等你 喺個醫院裏邊嘅居留咧係更加安全，同埋翻屋企嘅時候咧係更加容易去適應個屋企嘅環境。
So, are there some things that we can think about in terms of preparing? So, as you know, oftentimes people will go to the hospital. So, what do we prepare for? So, there are two pictures here, and we're going to be talking about the medicines, and we talked about that earlier. I think it's important perhaps to take pictures of the medicine that your loved one is taking, or just to have it on your phones so that if you get asked about this, you'll have a list of what the medicines are. And then the second thing is, you know, when you go to the hospital, other than perhaps a Chinese hospital, oftentimes the food is not really what we're accustomed to. So we know that family members try to express their care of their loved one by bringing them familiar foods. So this is a good thing, but it also has a risk. And the risk is sometimes there's not the best storage place, and there isn't always the flexibility of heating it up at the right time. And I'll have Diana talk about that a little bit more in Cantonese, because I know culturally for us, food is a big factor. We know food, we want people to heal, but there's some positives about it, as well as some risk in terms of safety. So medicine and food.
咁呢個咧就係譬如我哋真係假如間要入醫院嘅時候，我哋有咩嘢要預備嘅咧？咁正話已經講過啦 ，Jennie 就講過話係提咗嗰啲藥咧，你係會一係帶藥，一係就影啲相，一係就抄低嗰啲藥單咁，邊樣你方便做嘅，你咪做邊樣咯。咁就係即係因為呢個係一個好好嘅機會，等嗰啲醫生同你由頭到尾 check 晒你嗰啲藥 check 一次，睇下啱唔啱咁樣啦嚇。咁仲有一樣嘢咧，就係我即係同阿 Jennie 講過噶啦，就係話我哋唐人咧好多時有食中藥嘅，咁啲中藥咧有啲中藥咧同嗰啲西藥咧又會有啲大家有個互動嘅作用嘅，咁所以咧我哋如果係食中藥嘅咧，記住要話俾醫生聽。咁你食中藥你又未必有張藥單嘅，係咪？咁咧如果你有藥單嘅咧，你帶去不過都用中文寫咯。咁即係我哋而家醫院嗰度咧，就暫時咧，我諗除咗東華醫院啦，東華醫院有個中藥部咧，咁咧即係好多醫院咧都冇呢啲中藥部嘅，咁咧就要靠做一啲聯絡嘅功夫，醫院嗰度揾人去睇下呢啲係乜嘢嘅中藥。OK， 咁你一係可以影張相啦，影相我哋睇到係咩藥啦，咁咧就或者如果有張藥單咧都可以帶嚟嘅。咁如果個中醫師俾咗張藥單你咧，你可以帶嚟。咁我哋就算即刻唔可以做得到啊，咁都可以去查，同埋揾社會嗰度有啲資源可以知道嘅。咁呢個亦都係系統問題咯。如果我哋係多中國人嘅病人嘅時候咧，咁係可能喺醫院嘅藥物部啊嗰度係可能係有請一啲員工係識睇呢啲咁嘅中藥嘅作用，咁我可以知道有冇副作用嗰啲嘢咯。因為呢個亦都係非常之重要嘅環節嚟嘅。曾經有人因為有副作用而死嘅。咁第二樣嘢咧就係呢個食物嘅問題啦。食物咧咁Jennie 同我傾過嘅時候咧，就其實而家 Covid 咧就真係連人都唔俾佢，即係曾經 Covid 嚴重嘅時候啊，只係準一個親人認定一個親人先至俾你探，每日探一次咁樣，係要即係預定啲時間，講到清清楚楚嘅，因為唔想嗰啲病菌周圍走啊。咁咧而家咧個 Covid 嘅情況叫做輕微咗啦，咁大家咧都放鬆咗好多，咁醫院嗰啲例咧都放鬆咗，咁所以醫院嘅例咧係會跟住嗰個呢個新冠肺炎嘅走勢，而家仲係新冠肺炎啊，跟住佢嘅走勢而有時有改嘅，即係有時係嚴啲，有時係鬆啲，咁多啲病菌嘅時候咪嚴啲咯，少啲嘅時候咪鬆啲咯，係咪啊？咁所以咧，你係要同醫院嗰度做一啲好嘅溝通。咁我哋好多時咧，呢啲咁嘅食物咧，我同Jennie講嘅時候，大家都笑，因為我哋唔中意話俾人聽話我愛你嘅咁好肉麻咁啊嚇。咁通常咧話同親人表達愛意嘅時候，或者關心佢哋嘅時候咧，就係帶啲食物俾佢哋。如果佢係 做咗手術係咩嘢咧？佢個腸胃唔係幾好嘅時候咧，咁可能煲啲粥啊，咁特登咁樣適意咁樣去買啲特別靚嘅料啊，咁去煲好粥俾佢去食。咁呢個咧就係我哋嘅心意，亦都係對啲親人表達嘅愛意同埋關愛。咁咧呢個樣嘢咧喺我哋嚟講係非常之重要噶嘛。但係好啦，你而家又話 COVID 又乜又係乜咁，你唔俾我帶呢啲食嘢入去喎，咁啊親人係咪會覺得係即係覺得好似係綁住就隻手唔知點樣做咁樣咧？咁所以咧有時呢啲嘢咧，你真係要自己諗下，如果佢唔俾我帶去嘅時候，我可以點樣做？而且帶咗呢啲食物咧，如果你帶得多食唔晒嘅時候咧，以前咧就話有個雪櫃俾嗰啲病人嚟到裝嗰啲食物嘅 ，OK， 但係所有嘅病人咧都用嗰個雪櫃嘅喎，咁就變咗好容易交叉感染咯。尤其是有 COVID 嘅情況，咁而家有咁嘅細菌喺個社區嗰度蔓延嘅時候咧，我哋係唔可以咁樣做嘅。咁所以咧，亦都要大家諒解。所以呢個咧係家人啊、同病人啊、同埋醫療人員啦，要大家做個溝通嘅問題。所以呢個都係即係預備就還預備一件事，但係到入咗醫院嘅時候，係有啲嘢情況咧係要解決嘅。咁可能即係帶食嘢入去呢方面，可能係唔解決得到咯。不過好在咧，即係而家醫院咧嗰啲病人啊，除非你真係好大病嘅啫，通常都係好短時間你就翻屋企噶啦。所以如果係唔係啲食物太差嘅咧，或者可以個病人試下食，試一試睇下得唔得，中唔中意先咯。如果真係唔中意，先至同嗰啲醫療嘅人員講，睇下可唔可以點樣做，俾個家人帶嘢入嚟。不過真係每次帶嘢入嚟咧，就真係食幾多帶幾多好啦。你唔好話諗住食完有雪藏咁樣，食完可能抌咗噶，你會覺得好肉痛，因為嗰啲嘢可能好貴噶嘛。咁即係我哋而家係話聲俾你聽，等你知道下個情況咯。呢個係好多時因為食物咧係引起衝突嘅，家人同埋病人同埋醫療人員。
The key thing here is, if we have a parent who we know sometimes is unsteady and may go to the hospital, in addition to having written out in advance what the clinical conditions are and what medications they need, I would suggest just have a little bag ready to go in an emergency. In other words, if you know that sometimes, last year, your parent went a couple of times, so it's possible that they may need that. So having a bag with things that are real important, maybe important to them, even their own clock or something, so you're ready to go and have a chance to be more prepared at the time, say the ambulance comes to your home.
咁呢個真係好嘅。咁啊 Jennie 咧就提醒我哋咧，我哋可能係喺屋企嗰度咧，即係冇人想去急症室噶嘛，但係有急症發生嘅時候就要去急症室噶啦。咁啊，既然係急症啦，即係好急啦，即係冇咩時間預備啦，係嘛？咁所以咧最好咧就係預先有個袋咧裝住你一啲即係可能喺個醫院嗰度可以用或者需要嘅物品。咁咧到時嘅時候咧，去醫院嘅時候咧就可以一攞起就走，甚至你就譬如你啲眼鏡啊。聽個耳嗰個聽機啊咁樣，你唔可以預先擺咗落去噶嘛，因為你日日要用噶嘛。咁你或者有嗰啲嘢咧，你就用張紙仔寫住佢，可以擠咗落個袋嗰度就擠咗落個袋先。如果唔可以擠落去嘅，因為你用緊嘅話咧，咁你咧就喺側邊度寫住眼鏡，嗰個助聽器，或者係你嗰個假牙。或者係假牙裝假牙嗰個兜，或者浸假牙嗰啲水，即係所有嗰啲嘢咧，你將佢用張紙仔寫住佢咧，就黐咗喺呢個 bag 嗰度，咁就邊個同你去急症室咧，都可以同你好似執藥咁樣執單就擠咗佢落去啊嘛，咁變咗咧就比較好啲咯，到時你去到醫院嘅時候就有得用。
The next slide is about a condition called delirium. And this is actually quite common. What happens is the person goes to the hospital, and even perhaps in the emergency room, if they stay there for many hours, it's not unusual that people get very confused in a short time. So this is different from dementia, but this is more of an acute situation. But we want to prepare all of us that this is not unusual. And the next two slides will talk about how you can help both prevent it and manage it.
咁咧有一樣嘢咧，就希望大家都知道咧，就係個病人去咗醫院嘅時候咧，佢可能咧會有一啲膽妄症嘅。膽妄症係咩咧？即係個人啊，突然間好急咁樣咧，突然間發生咧，就係佢好混淆啊嘅意識，係即係可能又唔知道自己喺邊啦，連個名又唔記得啦，見到人又唔認得啦，即係好多嘢佢都突然間好似亂晒龍咁樣，咁咧就有少少發癲啦，其實係咪？咁咧呢個情形咧喺醫院嘅病人之中，尤其是喺急症室啊，或者係嗰啲深切治療部喺嗰度咧，佢係有成40%嘅病人咧係會有啲時間，部分嘅時間咧係有呢啲咁嘅症狀發生嘅。咁只係想大家知道咧，有個心安，呢啲症狀咧係時常都可能發生，但係好多時都係短暫嘅。咁啊，甚至脫水啊，即係有啲人飲水唔夠，老人家好多時都脫水嘅一個問題。咁呢啲咁嘅症狀咧，或者係個血糖低得滯咧，都可能令到佢有呢個咁嘅膽妄症嘅。咁啊，如果係我哋知道咗咩情況時候，即刻俾翻補充翻水分或者補充翻糖分咧，咁佢呢個症狀咧就可能會冇咗噶啦，就消失噶啦。咁所以，但係有啲咧就比較長啲嘅喎。或者係缺氧，咁佢可能長啲嘅喎，咁所以咧就有啲長啲，有啲短啲，不過通常幾日咧都會過嘅，就唔使咁擔心咯。如果係有事發生嘅時候，但係有一樣嘢咧，你亦都要知道，當呢個病人咁亂晒龍嘅時候咧，有時咧嗰啲醫院咧真係員工啊喺百無計策之下咧，可能要將佢哋綁住，即係跟住佢哋跌親啊！呢個係我哋萬唔想做嘅情形嚟嘅，唔想綁住病人嘅，一定要有好大嘅理由先至綁住病人。但係如果假如間喺你嘅親人之中，你見到佢俾人綁住咧，你當然心痛啦。但係心痛之餘咧，你或者同嗰啲醫院嘅人士溝通下，或者你留低喺度陪個病人，佢就唔使俾人綁住咧，係咪啊？即係可能有啲嘢要通融下俾你哋做，睇下邊方面可以做得可以，即係呢個始終都係溝通嘅問題咯，同個醫院裏邊。咁但係嘢係雙方溝通啊嘛，係咪？溝通係要兩邊人噶嘛，咁所以。如果佢哋唔知道你有問題嘅話，你要自己提出嚟同個醫院嗰啲人講。
Okay, so I think that one thing I want you to remember from this slide is that when you're visiting your loved one, you notice when something's different. So when you notice something different, make sure that you let somebody know that there's some changes going on. And it usually is fast. It's not like they always used to be confused at home and they're confused in the hospital. But if there's been a change that you notice, be sure to tell somebody.
咁咧，家人咧就係最好嘅幫手嚟嘅。其實，因為如果有家人喺度嘅時候咧，佢係同個病人最熟噶嘛，因為佢哋一齊生活噶嘛，係咪？咁如果你見到個病人有啲咩變化，喺佢精神上有咩變化，喺佢心態上有咩變化，或者有咩特別嘅狀況咧，你覺得有問題嘅時候咧，請麻煩你將你嘅睇到嘅嘢咧，同嗰啲醫院裏邊嘅員工講，話俾佢哋聽，提醒佢哋啊，佢今日好似個人混淆咗，比琴日差咗咁。你可以咁講嘅，或者你話唔係，佢今日好咗，琴日佢都唔記得呢樣嘢，今日佢知啦，佢認得我啦咁，即係個轉變啊，係。嘅細微之處咧，可能係非常之少，但係家人咧，你係知道嘅，咁所以咧，你嘅觀察啊，係可以幫到我哋嘅員工，係可以更好去服侍呢啲病人嘅。
Some of this you've seen about bringing medications, but one thing I want to raise is, sometimes people think about taking away their eyeglasses or their hearing aids just to put it somewhere safe. Please let them wear their eyeglasses. Please leave their hearing aids in, because that, and their dentures, as we say, because it helps them be more normal and it helps them be more oriented.
我哋有時好心咧，就諗住病人瞓覺同佢除咗眼鏡啊，除咗個耳機啊，或者同佢除咗嗰啲假牙咁樣。你可以咁樣做，但係記住佢醒嘅時候，你俾翻佢咯。唔好話佢醒咗嘅時候就當冇件事咁啊！你知啲員工係一班班噶嘛，可能係 上個班除咗，下個班又唔知頭路又唔俾，咁所以咧可能交更嘅時候咧，我哋係要比較溝通得好啲咯。或者話俾人聽，或者係個醫院裏邊有個系統就係話，病人所有嘅眼鏡啊、助聽器啊、牙嗰啲假牙嗰啲，通通係擺喺呢個位嘅咁。因為其實我哋如果係唔見咗你啲假牙咧，或者係唔見咗你嘅助聽器咧，你又唔方便啦。但係喺醫院裏邊都係好大損失嘅，因為我哋要賠俾你嘅。所以咧呢啲嘢咧係好即係好似好小事咁，但係其實個關係係非常非常之大嘅。所以 Jennie 話呢個咁嘅，我哋如果係設計一個系統咧，就一定要關注呢啲咁嘅細微嘅嘢，呢啲細微嘅嘢係非常之重要。
The other one is to just make sure that we talk in simple sentences, because sometimes when we talk casually, we might ask one or two things in our talking to somebody. But when somebody's hospitalized, try to keep things simple versus asking 2 or 3 questions at one time.
咁咧喺個病人嘅環境之中咧，我哋平時講嘢就一輪嘴咁樣講又長又深啦，但係同病人講嘢溝通嘅時候咧，我哋真係要好小心咁樣揀字嚟講嘅，係盡量要講得短，而且清楚同埋簡單，咁樣咧個病人咧先至容易明白咯。但係我哋盡量咁樣講啫喎，佢都未必明白嘅喎，咁我哋都要可能翻轉頭問下佢。你可唔可以話翻俾我聽？我淨係講嗰啲咩嘢啊？咁睇佢講唔講得翻轉頭咯。如果你每次講一樣嘢嘅，就睇下佢講唔講得翻嗰樣嘢啦。就千祈唔好話一講就講2、3樣嘢咁樣。佢一個病人咧喺個醫院裏邊咁混淆嘅情況咧，佢係好多時應付唔到嘅。呢個溝通非常之重要。
Okay. So there's more to learn, but again, you'll have these slides, and there's an opportunity to learn more information about delirium. But just so you know, most of the time it's temporary. And so that, and again, you should also know that delirium can happen after somebody goes home. So it's not just in the hospital. So just keep attentive to make sure your loved one is stable.
咁咧就Jennie 真係提我哋好重要嘅嘢，就係呢個膽妄症咧。第一就可能係好短暫嘅，幾日啊或者1、2日啊咁就過咗嘅，甚至幾個鐘頭可以過咗嘅。咁第二咧就係呢個膽妄症咧就唔係淨係醫院嗰度發生嘅喎，佢係可能係因為入過醫院，但係佢翻咗屋企嘅時候咧，佢都可能有啲膽妄症突然間發生嘅喎。所以咧，如果有呢件事發生嘅時候咧，咁你當然係要話俾醫生聽啦，因為可能有啲藥唔係幾啱啊，諸如此類咁啦，係嘛？咁或者係飲水唔夠，或者可能有好多種情形嘅，或者係突然間發炎啊，發炎都可以整到佢有膽妄症噶嘛，個人混淆啊、發燒啊咁樣係咪？咁所以咧如果有任何嘅情況咧，就最緊要始終有一個字咯，就係溝通咯，即係你要同醫療人員溝通。就唔好話冇咩事嘅，等唔理啦咁樣。咁就算係冇咩事都好啦，你話聲俾醫生聽先啦，即係唔會蝕㗎，係咪啊？咁等個醫生早啲知道或者同你解決個問題早啲咧，係咪
？This slide is one that Diana has done nicely to just remember that there's the risk of falls, and while we need to protect people, we also need to make sure that they can walk safely with assistance. So this is literally a balance of safety and being able to functionally keep your muscle strength.
The only thing I want to add would be that fall is one of the biggest tragedies in hospitals, because this is where patients will end up with another injury beyond what they come in for. And we definitely do not want that to happen. So fall prevention is a safety measure, benchmark that every hospital has to work hard at. We want to have 0 falls, 0 patient falls, and we work hard to achieve that. And if you remember just now, we talked about patients with delirium or depression or different things, right? Their mentality is different. And so sometimes it's easy to say, but it's hard to do in certain situations, because we don't have 24 hours, somebody sitting next to the patient, right? So 即係呢個預防嘅跌倒咧嘅治療咧係非常之重要嘅。喺醫院嚟講咧係唔希望做到係會零跌倒嘅，即係冇病人跌倒嘅。咁呢個係講就容易，做就可能有啲困難嘅。但係我哋係會盡量做咯。咁啊，呢個家人啊咁樣樣。So if patient use walking aids at home with a stick or something, you can bring it by. Because sometimes it's easier, the thing is adjusted to the height, it's easier for them to use their own walking aids than what we give them. We certainly can give it to them, but sometimes it's better that they use their own because they're more familiar with it. So those are the additional stuff, but it's a big item. That's why we want to pull it out and put it in red and in big letters. We don't want anybody to fall in a hospital.
The last slide has many items, but I'm going to talk primarily about one, and that is pain management. It's so important that a lot of older people do experience pain, and this may especially happen in the hospital. And many people get intravenous pain medication that gives them some relief and comfort, but then they go home. And sometimes the stopping of the intravenous medicine and quickly changing to pill form may be a bit of a major change for somebody. And so that pain actually is not relieved. And so this is something, if you know that you have pain or your loved one has pain, have a chance to talk to the nurses or the doctors at least a couple of days before they get discharged, so it isn't so sudden. This is when sometimes people get this kind of change and it's not sufficient pain management, which then creates problems and the person comes right back to the hospital. So it's an area that we need to be sensitive to, make sure they get the management they need. But when they switch over and are getting ready to go home, if you have any concerns, be sure to talk to a nurse or doctor.
Thank you so much. 真係好多謝 Jennie， 呢個係一個非常之重要嘅環節嚟嘅，就係呢個痛嘅管理。因為好多時你入醫院係因為要做手術或者係要做咩化療、電療諸如此類咧，咁可能翻屋企嘅時候咧，可能有啲痛啊，有啲作嘔作悶啊諸如此類。咁喺個醫院嘅時候咧，佢係會俾嗰啲吊鹽水咁樣吊啲藥入去俾你嘅。咁當然吊鹽水入到啲血嗰度，直接入到啲血嗰度，咁即刻可以將嗰個腫痛解除，就非常之容易啦。但係如果佢將個藥啊，吊鹽水嗰啲藥咧，止痛藥係將佢改咗做口服藥嘅時候咧，口服藥嘅時候就完全兩回事啦。因為口服藥嘅藥量啊，同埋嗰個吊鹽水嘅藥量咧，第一就唔同，第二咧就連藥都唔同嘅，個藥名都唔同嘅。咁所以咧，喺一個病人如果佢係有痛喺醫院嗰度痛，而醫院係用吊鹽水嚟到幫佢解痛嘅時候，止痛嘅時候咧，佢如果轉做口服藥咧，佢應該係喺醫院嗰度咧最少住多1日。等呢個口服藥知道係有冇作用，係可唔可以控制到佢嗰啲痛，然後先至放佢翻屋企嘅。咁如果你想個病人快啲走嘅時候，你咪快啲轉咯，即係唔好等到臨走之前先轉咯。咁可能有問題啦，因為個病人翻到屋企，原來嗰啲口服藥止唔到痛嘅喎，哇咁就慘啦，起又起唔到身，你又話想叫佢行又乜，佢根本都起唔到身，佢痛到喐都喐唔到，咁你點叫佢起身行咧？咁於是咧跟住咧就有好多問題發生啦。OK， 所以呢個係一個好大嘅環節咯。咁大家如果知道咗嘅時候咧，你如果係有親人啊或者自己啊喺醫院嗰度做病人嘅時候咧，呢個你就要同醫生話，你諗住幾時同我放我走㗎？翻屋企㗎？佢話如果係聽日嘅，哇咁我而家仲係吊緊鹽水嗰啲止痛藥唔得嘅喎，咁你可唔可以而家即係同我換咗做口服嗰種藥啊？等我試，最低限度都有大半日，等我試下呢個藥幫唔幫到我止痛先得㗎，係咪？咁所以呢個有好多時啲醫生又佢係被人逼嘅，可能係有其他嘅人逼佢話，喂，呢個病人喺度住咗咁耐，你佢要翻屋企㗎啦，夠期㗎啦咁佢咪即係個醫生都唔想，但係佢係要做，咁就同你翻屋企咯。所以佢又即係預備得唔好，又同 同你轉藥轉得唔夠快咁。呢啲嘢咧就大家清楚明白啲嘅時候咧，就同醫院嗰啲醫生做啲好嘅溝通咧，咁就變咗係大家冇問題啦，因為啲嘢做得啱啦。呢個就係系統嘅問題啦。當你有系統做嘢嘅時候咧，就會做得啱，就唔會出咁多錯。
Well, again, there are more topics here that probably merit another different session, talking about advanced directives and having supportive care as we reach the end of life. The important thing here is I want you to know that it's important to be able to feel confident when you get discharged, that you know what you should be doing at home. So don't just be silent, especially if you're worried about what to do or what to look for. Try to find your voice and ask these questions, because you'll feel better and your loved one will be safer. But don't hesitate to ask questions. If somebody talks too fast, ask them to repeat it again, because it's important that you feel that you know what to do if you had a problem when you go home. So important thing is find your voice and ask the questions that you need. So I thank you for staying with us for this long time. I'm sorry that we had to go over, but I will turn this back to Diana to go through the last bits of information about how to contact us. But thank you so much for taking the time for being here today. But again, find your voice. Don't be afraid to ask questions.
Thank you so much, Jennie. 我哋好多謝陳禎娜女士今日嘅講座咁好嚇，咁就佢最後咧就提我哋唔好怕問，我哋好多時咧係怕麻煩人，唔好怕麻煩人，呢個係你嘅權利。請你有問題就問 ，OK？ 問得唔清楚嘅就再問。總之就將件事搞清楚，咁啊對大家、對病人又好，對家屬又好，就算對我哋嘅醫療團隊都係好嘅，即係三方面都好嘅。咁希望大家會咁樣做啦。咁啊好啦，講咗咁多，多謝各位今日收聽，祝各位健康，請保重。
Well, we'll leave it at that, but I thank everybody for participating.
Yes, thank you everyone.